Hello, today we're going to have a talk about sleep apnea. We'll start off with what is sleep apnea and then how we measure sleep apnea. Well, there are actually two types of sleep apnea, a central type and an obstructive type. And it's the obstructive type that is the most common, and that is what we're going to talk about today. So what actually happens when you have obstructive sleep apnea? The problem is that you stop breathing because the airway collapses. It actually collapses in the upper part of the airway behind the tongue. So when the airway collapses, you still try to breathe, but you can't get any air through the airway. So you have a pause in breathing during your sleep. Well, what are the causes of this collapse of the airway? Well, number one is anatomy. Of course, if you have a short neck, there's less room for the structures in the neck, and then there's a bigger chance of an obstruction with less room for the airway. If you have a chin that is further back, the tongue moves further back in the throat. And if you have a bigger tongue, it's also has a larger risk of collapsing posteriorly into the airway, obstructing the airway. The second reason for sleep apnea is age. We all know that everything gets more loose and less tight with age. And this is also what happens in the throat. The muscles and the sinews in the throat simply gets more elongated and looser, and then there's a bigger risk of the airway collapsing when you sleep. The third reason for sleep apnea is weight, because when you're overweight, you don't just have excessive fat on your tummy, you also have it in the throat, and when it's in the throat, there's a risk of it obstructing the airway, so there's less room for the airway and therefore increase the risk of it collapsing. Well, what actually happens when you have sleep apnea? Of course, if you can't get any air in the body, your oxygen saturation decreases, the pulse increases, the blood pressure increases, a lot of stress hormones flow out into the body, and the brain awakens every time you have an apnea. Um, the biggest problems with sleep apnea is the development of daytime sleepiness. People simply get tired in the daytime when they've slept so poorly during the night. But the big medical problem is that it increases the risk of stroke and myocardial infarction, increased blood pressure, and a lot of other really, really bad stuff. Um, so how do we measure sleep apnea? Well, we usually use a cardiorespiratory monitoring system, which is a system that measures airflow on the nose, respiratory movement by having measurements on the thorax and abdomen. Then we measure the pulse and the saturation on your finger. Um, this is an example of equipment that can be used for sleep apnea measurement, and you can see in the nose the airflow measurement, on the finger the saturation measurement, on the thorax and abdomen the measurement of movements of trying to breathe, and it all goes together in this small computer on the front of the thorax. What do we look for when we look at the results from this cardiorespiratory monitoring? We actually measure episodes where you stop breathing for more than 10 seconds. That's an apnea. We also measure periods where there's less than normal breathing with a decrease in saturation. So you try to breathe, but there's not really enough air going through your throat and into your lungs. That's an hypopnea. And we calculate that into an apnea hypopnea index. And index simply means that we calculate how many apneas and hypopneas in total have you had during each hour of sleep. So if you have 80 hypopneas and sleep 10 hours, that's an AHI of 8. We also on the measurement see if it's a central or an obstructive. Of course, it's obstructive if you try to breathe, but there's no breathing. And it's the central if you simply stop trying to breathe. So what's the measurements we get out of this CRM measurement? Well, the AHI is normal if it's below 5. It's mild sleep apnea if it's between 5 and 14. It's called non-treatment needed. Moderate sleep apnea till 29, and then severe sleep apnea. And there are actually some patients that have really severe sleep apnea. 100 times an hour they can stop breathing for more than 10 seconds. And that's very bad for you. So what do you need to notice when you get your results of the cardiorespiratory monitoring? The most central thing is, what is your AHI? The second thing is it obstructive or is it central? And is there a difference with the position? Some people only have sleep apnea when they lie on their back. That's important information because maybe the problem can be solved by just not sleeping on your back. Uh,